Look, if you're a cold-blooded American like me, I know you're tired of being told what to do. Being told to take a jab in your arm so you don't have to take another hospital bed away from sick patients across this country. Look, it is my goddamn American right to take whatever hospital bed I want. You can't tell me not to take another hospital bed from another sick patient. Why? Why would you tell me such a thing? Listen, I will shoot a foreigner before I take a shot, damn it. Look, if you feel like me, if you feel like you deserve to take whatever hospital bed you want, I got the person for you. I've got Dr. Freedom here. He's in studio. He's ready to tell you about your rights and the communist propaganda about the vaccines. Just don't think too much about it. Here he is. Welcome to the studio, Dr. Freedom. Hello, everyone. I'm a doctor. My name's Dr. Freedom. My mere existence is simply based on the fact that I hate my own life. And I decided to take advantage of American distrust in American institutions simply because it helps make me more money. No one has ever read a book that I've written before until now. Simply because, well, I can lie to people and it's popular now. Well, that's something to think about. I'm going to tell you about the communists and the weird rapid campaign to try to stick you with this jab that might actually save your life. That if you think about too much will actually not make much sense. So, hear me out. There's these things called variants. You see, the variants are used by the Democratic Communist Party so that they can gain more control over you. The thing is, if you think about it, that's a little weird because these variants are actually hurting the elected Democratic Party candidate Joe Biden because now there's a lot of death and the economy is not doing too well and all of these things, and they're still using it to gain control by hurting their own popularity. And don't think about it too much, damn it! Don't think about it! God. So, you can see here that these variants, and they get all these weird, wacky features that are part of virus evolution that I don't believe in because I don't believe in evolution. Such as escaping previous immunity. Wow, that's weird. And getting more infectious. Oh, that's weird too. It's not like there's an evolutionary advantage of that. So sometimes they tell you that vaccines are actually prevent you from getting sick. You see, vaccines have about, especially since Delta, 70-80% efficacy. That means about 1 in 5 will get sick. But because I know one person that's gotten sick with the COVID vaccine, because I have 5 friends, I have a bunch of friends who have been vaccinated, and then one of them got sick, all after they've been exposed to COVID, that means that the vaccine doesn't work whatsoever, right? I think that's totally the conclusion that I should be going for here. So, yeah, think about it like that. Don't think about it in actual statistics. So, even though the COVID vaccine has lost efficacy over time, simply because viruses evolve to evade your immune system, that means the vaccine doesn't save lives or help anyone anymore. I think that's a totally logical conclusion. So, Omicron's real wacky. It got really contagious for some reason. Viral evolution is weird. Never mind, I don't believe in that. So it has an R naught of 10. Whoa! And it's almost entirely avoided the original vaccine immunity. That means almost everyone I know who's had 2 doses of the vaccine has gotten sick. That means the vaccines don't work whatsoever, right? And that means a 3rd dose is utterly pointless, even though the science says that a 3rd dose decreases your chances of getting sick by another 40% and keeps you out of the hospital at an even greater rate. So also there's these new studies coming out that shows that natural immunity, this little thing called natural immunity, is so much better. It actually reduces your chances of getting sick by like 60%. And I believe that you should get a disease so that you don't get a disease. Yeah, you should just get the disease. Yeah, you should do that because I'm a doctor. You see, I'm a doctor, and that getting a disease to not get a disease is the perfect public health policy. Yeah, you should just skip that step where you still might get sick, but when you do get the disease, it might keep you out of the hospital. Just skip that and just go straight for the disease because that's like we're speedrunning this shit, okay? So yeah, 2 doses, and that, yeah, so whatever. And now I'm going to show you this wacky graph that actually might show that the vaccines help, but that's all liberal propaganda. You see that all cases combined, we had our March 2020 strain and something and so on. And right now, a lot of people are vaccinated, but cases are through the roof. It's weird. It almost like it has nothing to do with the fact that Omicron has gotten really contagious and adapted to the vaccine immunity, even though the vaccine is still keeping people out of the hospital and keeping deaths at an all-time low. That's, not really that important to me, especially relative to the number of actual cases that existed, that if there were actually this many cases whatsoever with no vaccine program, that the total amount of deaths would probably be far up here, and we'd be in a really shit ton of trouble trying to keep hospitals open and massive lockdowns. And even though these damn vaccines have saved the economy, I really don't care. And I just think that all of this misinformation and distrust is actually really beneficial to me, so that I can keep going, living my life lying to people, so that I can keep making that green and writing those damn books that everyone keeps buying. So, you know what? Just because vaccine deaths are actually low and relative to all deaths, we're doing really good, especially during the Delta period when deaths from the vaccine were 1/10 of anyone who was in the hospital. I think you should still just skip that step, and public health policy should always be just speed run this shit, okay? So, yeah, I'm off to go make more money writing books. See you later, bros. Bye. I hope you enjoyed that from Dr. Freedom. Look, I hope you enjoyed that. Again, don't think too much about it. I had fun making that. I did. I just had a great time. Obviously, parody. I hope you enjoyed. I'm signing off. This was just a fun thing in response to a Fox News video that I saw. I didn't even want to share the clip. I didn't care because, damn, I'm tired of Fox News. So, yeah. Hope you enjoyed that. Peace out. Bye-bye.